The United States is home to some of the best doctors, most advanced hospitals, and cutting edge medical technology in
Let's
the
go.
world. Yet, the
I wake
American
up to a
healthcare
little bit of drool
system
on my
is one
pillow,
of the
feel like
most
it's gonna be a bad
expensive,
day.
inefficient,
Yeah, I'm
and
tired of
unequal
shit, and the
systems
coffee
among
ain't hit yet,
developed
damn, ain't
nations.
that great.
Despite
I
spending
don't
more
wanna
than
go to
any
work cause
other
my boss
country
is a
on
jerk and I'm
healthcare,
not even
over
that paid.
$4.5
I need a
trillion
change in my life cause I
annually,
don't feel alive and
millions
there's
of
nothing that makes me
Americans
happy.
remain uninsured
Hold my
or
beer for a minute,
underinsured.
I'm about to quit my
Medical
job, cash in
bankruptcies are
for a
common,
ticket. I'm
and
going on a
life
trip and I don't
expectancy
plan to
is
visit.
lower
I'm gonna
than in
stay there
countries
till I
that
feel
spend
like I'm
far
winning
less.
all. And this
So,
is just the
what went
beginning.
wrong?
I need a big
Why
change,
does
only
a
feel like
country with
living. I
such
need a big
immense
swing,
wealth and
home runs I'm
innovation
hitting and I'll
have
never
a
look back.
system so
Moving on till I
plagued
get
by
it all.
cost,
And
complexity,
we
and
all got
inequality?
dreams.
And
We
perhaps
all
more
want big
importantly,
things.
how can it be
What you gonna
fixed?
do for it? How
To
you gonna
understand
move for
why
it?
the
What you
US
gonna
healthcare
be?
system is broken,
And do you
we need to look
believe
at its
you
structure.
can do
Unlike
anything?
many other wealthy nations
What you
that
gonna
provide
do?
universal healthcare through
What you
single
gonna
payer or multi
be?
payer models, the US system is fragmented. It's a patchwork of private insurers, government programs like Medicare and Medicaid, employer based coverage, and out of pocket spending. This fragmentation breeds inefficiency and confusion. One major problem is
Yeah, this is
cost.
my life, my
The
strength,
US
my right
spends
to
about
fight, to die
17% of
on.
its GDP
And this
on
is my game
healthcare,
to play, to
nearly
claim
twice
a
as much
brand new
as
name.
countries like
Oh,
Canada,
and I ain't gonna
Germany, or
lie to you,
Japan.
I'm a bit
But this
nervous
extra
that I might
spending
screw
doesn't translate
everything
into
up that
better
I've ever done.
outcomes.
But what's the point of living
Americans
if
have
you ain't
higher
having
infant
fun?
mortality rates,
I guess I'll
lower
try
life
this, try that,
expectancy,
might
and more
miss, gotta
chronic
find what I'm
illness
good
than
at.
people in many other
I guess
high
I look
income
here, look
nations.
there,
A
overwhelmed, and
large
scared where
portion
my
of the money
head.
goes not
I
to
gotta make it
doctors
in this
or
life.
patients,
Whatever makes me
but
happy,
to
know I'm doing things
administrative
right.
overhead,
Sleeping in the summer on
insurance
a goose
company
that's right. Or
profits,
find a
and
nightclub
bloated
for the
billing
end of the
systems.
night. Oh, and
Administrative
we all
costs
got
in the US are
dreams.
staggering.
We all want
Hospitals and clinics
things.
employ
But what you gonna
entire
do for it? How
departments
you gonna
just to
do
deal
for it?
with
What you gonna
insurance coding,
be?
billing
And do you
disputes, and paperwork.
believe you
It's
can do
estimated that up to
anything?
30% of
What you
healthcare
gonna do for
spending
it? How you
goes
gonna
toward
be? What you
administrative
gonna
functions, more than
be?
twice the average in other countries. This adds complexity and drives up prices for everyone. Another critical issue is access. Unlike countries with universal coverage, the US ties health insurance largely to employment. This means that if you lose your job, you often lose your health coverage too. Millions of Americans are uninsured, and millions more are underinsured, meaning they technically have insurance but can't afford to use it due to high deductibles and copays. This leads people to delay care or skip it altogether, often resulting in worse outcomes and higher long term costs. Prescription drug prices are another disaster. Americans pay more for medications than anyone else in the world. Why? Because the US government doesn't negotiate drug prices the way other countries do. In nations like Canada or the UK, national health authorities bargain with pharmaceutical companies to keep prices down. In the US, drug makers set their own prices with little restriction. As a result, life saving drugs like insulin or cancer treatments can cost thousands of dollars per month, leading some patients to ration or forego essential medication. Medical billing is notoriously complex. The same procedure can cost vastly different amounts depending on your insurance provider, your hospital, or even your zip code. There is little transparency in pricing, making it nearly impossible for patients to shop around or plan financially. One person's routine visit might cost $150, while another's could cost $2,000 simply due to network status or negotiated rates. This unpredictability creates stress and financial hardship for millions of families. Then there's the issue of profit. The US healthcare system is heavily influenced by private corporations, including insurers, hospitals, pharmaceutical companies, and device manufacturers. These entities often prioritize shareholder value over patient care. Insurance companies, for example, routinely deny coverage for necessary treatments in order to protect profits. Hospitals may focus on lucrative procedures instead of preventive care, and drug companies may spend more on marketing than on research and development. Despite these challenges, many Americans believe they have the best healthcare in the world. In some ways, they're not wrong. The US leads in cutting-edge treatments, specialized care, and medical innovation. If you need a complex surgery or a revolutionary cancer therapy, American hospitals are often at the forefront. But this excellence is not accessible to everyone, and that's the core problem. In the US, quality often depends on wealth, employment, or sheer luck. So, how do we fix this? The first and most discussed solution is universal healthcare. Countries like Canada, the UK, France, and Germany all provide healthcare to all citizens as a basic right. Some do it through single-payer systems, where the government pays for care, as in Medicare for all. Others use regulated multi-payer systems that combine private insurers with strict government oversight. In either case, everyone is covered, costs are lower, and health outcomes are better on average. Medicare for All, for instance, would expand the existing Medicare program to cover all Americans, regardless of age or income. It would eliminate private insurance for basic care, simplify billing, and allow the government to negotiate drug prices and provider fees. While critics worry about tax increases or government control, supporters argue that the savings from eliminating administrative waste and reducing drug costs would more than offset the expense, and people would no longer face premiums, copays, or surprise bills. Another possible solution is a public option, where Americans could buy into a government-run plan like Medicare if they choose. This would create competition with private insurers and pressure them to lower costs and improve service. A public option wouldn't disrupt existing employer coverage, but it would offer an affordable alternative to those priced out of the current market. Beyond insurance models, there's also the issue of transparency. Reforms that require hospitals and insurers to disclose pricing for procedures in advance would help consumers make informed choices and avoid surprise bills. Some hospitals have started posting prices online, but enforcement and standardization are still lacking. Tackling drug prices is another critical reform area. Allowing Medicare to negotiate directly with pharmaceutical companies, something currently prohibited by law, would significantly reduce costs. Other countries pay far less for the same drugs simply because they have more negotiating power. Implementing price caps or reference pricing tied to international averages could also help. Addressing administrative bloat is essential. Simplifying billing systems, standardizing codes, and reducing redundant paperwork would free up doctors and nurses to focus on patient care rather than bureaucracy. Some countries have demonstrated that even with multiple payers, systems can be efficient if they're standardized and regulated. Shifting the focus to preventive care would also make a massive difference. Much of U.S. healthcare spending goes toward treating chronic conditions that could be managed or avoided through early intervention. Obesity, diabetes, heart disease, and smoking-related illness cost the system billions every year. Investing in nutrition programs, fitness initiatives, mental health support, and regular screenings would reduce long-term costs and improve quality of life. Mental health is another area where the US system falls short. Access is limited, stigma remains high, and insurance coverage is often inadequate. Expanding mental health services, integrating them into primary care, and increasing funding for therapists and counselors would provide long overdue support to millions. Of course, none of these reforms are easy. Healthcare is deeply political in the United States. Powerful interest groups, from insurance companies to pharmaceutical giants, spend billions lobbying Congress to protect their profits. Public opinion is divided, and many Americans are skeptical of government-run programs. But the current system is failing millions of people every day. In recent years, support for healthcare reform has grown. Polls show that a majority of Americans favor some form of universal coverage or expanded government role in healthcare. The COVID-19 pandemic laid bare the weaknesses of the current system. Overcrowded hospitals, lack of paid sick leave, job-linked insurance failures, and glaring health disparities among racial and economic Fixing American healthcare requires courage, compromise, and vision. It means reimagining health not as a commodity for the wealthy, but as a human right. It means taking on powerful interests to create a system that works for everyone, not just the privileged few. It means investing in people, prevention, and equity rather than profit margins and paperwork. The path forward won't be easy, but the rewards, lower costs, better outcomes, and a healthier population are well worth the effort. It's time to stop patching holes in a broken system and start building one that truly serves the people. Because in the end, a nation's health is its foundation, and if we get that right, everything else becomes stronger.